a lot of people, I hear people talking about, oh, people are changing recommendations. First, they told us we didn't have to wear the mask. Now they're saying wear the masks again. And I use an analogy for that. It's like an umbrella in the rain, right? And you could talk about COVID prevalence like rain, right? When it's raining out, you might use an umbrella to protect yourself. And so when there's high COVID prevalence, you will wear a mask to help protect yourself. When it stops raining, you might take your umbrella down. You don't need it. The rain isn't around. Well, the same thing with COVID prevalence. When there's not a lot of COVID around, you might be able to recognize that and take your masks off. That's the period of time we saw at the end of June. But very, very rapidly, we have seen an increased prevalence again. It is raining again. So it's time to put the umbrellas back up to protect ourselves. It's time to wear our masks again to help protect ourselves and lower the spread of the coronavirus. And so it's logical, right? It's a response to the current conditions that masking requirements might change. And nobody should be surprised by that. It's just simply a recognition of the current conditions. And currently, there is high prevalence of the coronavirus with a strain that is very highly transmissible and creates higher viral counts in individuals that are infected. And so it's very, very prudent, especially in indoor environments again, to wear a mask at this point in time.
Yeah, so we are seeing what are being termed these breakthrough cases. So that is occurring in our community just like it is across the country. And as you can see here in the Commonwealth, of the 228,000 cases occurred in not fully vaccinated, and just 3,000 or 0.072% of the cases being breakthrough cases. Again, 97% of people sick enough to be hospitalized were unvaccinated, with 0.0047% being these breakthrough cases of fully vaccinated. And again, the same thing with deaths. 98% of deaths were not vaccinated, whereas 0.0011% or 50 individuals in the Commonwealth. So the risk is not zero. And as Mike spoke, we're masking. Now, if there's a storm, it's raining out, and we're recommending increased protection, including for the vaccinated at this point. But there is no question that the vaccine gives much greater protection than the unvaccinated. And Delta is just ripping through unvaccinated individuals and communities at a very alarming rate. Here at our health system, we have had a handful of patients who have been hospitalized with Delta and breakthrough cases, but none of them to date have been sick enough to require ICU care, and they're generally not as sick as our unvaccinated patients.
Is there any truth to the rumor that the vaccine has caused infertility in women?
That is complete misinformation. That is not founded in any reality whatsoever. There's many of these myths and misconceptions and misinformations that are being placed out there by those that are quote anti-vaccine, and those get perpetuated and amplified with social media and other outlets. And it's very unfortunate. It is absolute misinformation. There's no truth to that whatsoever.
And you had mentioned that the vaccine does potentially become less effective over time. Should people be worried right now about the efficacy of their vaccine if they got it already earlier this year?
Well, the positivity rate in our region is over 10% right now. So it is where we were at the height of the pandemic in the winter. So I think there is some concern even for the vaccinated, and there needs to be some prudence and care to protect yourself at this time when things are really raging and when the virus is really prevalent in our community with Delta. We don't really know how much the vaccines wane in their immunity over time at this point, and that's something that's being looked at very closely right now. And hopefully within the next few weeks to months we'll have some information. But quite honestly, once these boosters are out, this Delta variant will, have already run its course. So it's unlikely there's going to be any recommendations or implementation of boosters prior to Delta having, run through this peak, which we're living through right now. But in the future, we'll be getting more information on that. I mean, the vaccine is the treatment. I think earlier in the pandemic when this came out, I said we received a shipment of hope. At this point, the vaccine is the way out of this pandemic. There are no really efficacious treatments for COVID at this point. Natural immunity appears to wane and not work for some of these newer strains of COVID, so that doesn't protect you. So the vaccine is really the best thing that we have at this point to protect us. And in any pandemic, a vaccine is really the way to treat this and prevent things from continuing to worsen and progress.